Morning, everyone. My name is Megan Brooks. I'm the Director of Marketing here at Sleep Charge by Fusion Health. And it's my pleasure to welcome you to our Sleepless in America, the link between sleep and chronic conditions webinar.
So I'm Jeff Dermer. I'm actually a systems neuroscientist, neurologist by background in sleep medicine and a sleep medicine physician. I just want to go over something today that really hasn't been talked about that much within the medical system, but really spend time discussing a component of your health and your well-being that is incredibly medical, it turns out. And there's a large amount of data now in the literature that really hasn't made its way into the hands of folks out there. So what I want to do today is talk a bit about the connection between sleep itself and a number of very well understood and well-known chronic diseases, and relate them to the three basic neuroscientific associations with sleep and the underpinnings of sleep. And those three are the duration of your sleep, the timing of when you sleep, and the quality of sleep. And then towards the end, we'll talk a little bit about how you can use these constructs of duration, timing, and quality to improve your sleep and to avoid these issues of chronic disease. So we'll start with the fundamentals of sleep. As I mentioned earlier, those three fundamentals are sleep duration, which is how long you sleep, as well as sleep timing, which is when you sleep over a 24-hour period. So are you sleeping in the daytime as a night shift worker, or are you sleeping in several bouts as a parent with new children? As well as sleep quality, which is when you get that sleep and when you sleep, how good is that sleep? And that is something that often is a black box for most people. And we'll talk a little bit about the impact of quality. It turns out to be one of the most important components. So let's start with sleep duration. This is this is the most commonly studied component because it's easy to understand sleep duration. We can ask large populations exactly how often or how long do you sleep. And so this reflects the amount of time over a 24-hour period you sleep. It's directly associated with your age, gender, and your personal sleep history. And by that I mean, as you get older in life, your sleep duration changes. And especially if you look at small children, how much sleep time they actually get is very much a component of their maturational age and their need for things like neurodevelopment. There are also effects of personal sleep histories that many of us basically have sleep histories that, we just don't sleep that much. We're shorter sleepers, and that may be our norm compared to people who might be much longer sleepers. So using an average, which is something we often see, may not be a great way to compare yourself, because compare yourself against the average just might make you feel like you're not average, and that may be okay. This is actually one of the most well-known modifiable risk factors associated with a number of chronic diseases that often fall into the neurologic, metabolic, and cardiovascular realm. And we'll touch on these as we go through some of the chronic diseases associated with sleep duration changes. Sleep timing, this is a reflection of when you sleep. And as I mentioned earlier, this can be a regular component or an irregular component of your day over the 24 hours. And this is also dependent on age. It turns out that when you sleep as a child, often going to bed earlier, waking up earlier, that changes dramatically when you become an adolescent. And we often see our kids waking up to go to high school way too early for their regular circadian or activity in their brain related to day and light. And that's something that even over the course of adulthood changes as well. Your health itself can also affect when you sleep. If you have a series of health issues, you may find yourself not sleeping well, but also if your health is quite good, you may find it actually strengthening the timing of your sleep so that becomes more regular. The time of year, depending on where you live on Earth, if you live away from the equator and towards the poles, you'll find that the light-dark cycles actually can be responsible for changing your sleep timing. And then again, the genetics that you're born with actually predict your own internal clock, which could be a little longer or shorter. So that means that you get sleepier earlier or later as just part of your normal wake and sleep cycle. Last thing about sleep timing is that we know that people who sleep off of their normal circadian time also have significant risk factors for cardiovascular, metabolic, mental health, and immune health issues, even cancers. So we know that circadian timing when you sleep is ultimately very supportive for these aspects of health. The last component, as I mentioned earlier, is sleep quality. And this really is more difficult to quantify for most people because you kind of know how often you sleep regularly, and you actually know how much time you may sleep. You may even set an alarm clock to do that. But sleep quality is harder to detect. It's really reflecting the ability of your brain and body to progress through the depths of sleep stages. And there are multiple sleep stages, and even REM and non-REM sleep stages. And it's the way you progress through that without being interrupted by things like sleep disorders or sleep disturbances that reflects your quality. Less disturbance, less disorders, less interruption, the higher your quality. This is also determined by things like your genetics and the environment you sleep in. So if you sleep in a loud and, and light environment at night, that might be very difficult, like people sleeping through the day for night shifts, versus even having a general health issue. So if your health is not very good at certain times of the year, like you happen to have the flu, like many people do right this time of year, you may find it difficult to sleep. It may affect the quality of your sleep. Similarly, if your health is quite good and you're active and you're exercising, you may find your sleep quality much better. And again, this is something that changes over the course of our lives. The last thing to know is that sleep quality is variable, as you probably know yourself. I'm just getting sick from now and again, and that there are very common sleep disorders that actually go unnoticed is something that most people don't know. And that's part of our discussion today, and wanting to bring this topic to the front, because common sleep disorders that cause physical, mental, and emotional issues in people often don't really get noticed until they cause those physical, mental, and emotional problems. So hopefully this discussion today will help you sort that out before you end up being affected by that. So let's start with the connection between sleep and the chronic conditions that we kind of mentioned here in the beginning. First, let's start with why sleep matters and sort of the biggest picture. Let's step way back and look at the world. And this is an interesting study that the RAND Corporation did in 2017. And it looked at multiple countries around the world. And as a component of their gross domestic product, they actually calculated the impact of insufficient sleep across all of these cultures. And the interesting thing to me wasn't that they actually were able to come up with a figure, which is actually pretty startling in many places, especially the United States, but that they were able to show that this is pretty significant across all cultures and all of these 6 major industrialized nations. This has also been done for a number of other countries across the globe, but it's a very common, unfortunate fact that as you become more developed and westernized, if you will, and things like light pervade the night, and so do our 24/7 schedules, it really impacts health. And it impacts at least 90 million US adults on a daily basis. So this is something that's now being measured since 2017, and as well as by the RAND Corporation, but also by the CDC in the United States and other countries' public health officials. Here's what the CDC has to say in regards to chronic disease. So what we know is that 6 in 10 American adults actually have a chronic disease, which is maybe pretty startling, and that actually 4 in 10 have 2 or more. If you look along the lower edge of this infographic, you'll see that heart disease, cancer, lung disease, stroke, Alzheimer's disease, diabetes, and chronic kidney disease top the list. And all of those disorders themselves are impacted or made worse by, or even caused by, sleep disorders and sleep deprivation. So we know 133 million US adults have these chronic diseases. We know that 90 million US adults are sleep deprived on a daily basis, and it's impacting these chronic conditions. Now, the intersection is quite interesting. There's been thousands of published investigations over the last 20 years demonstrating the fact that poor sleep duration, timing, and quality all allow chronic diseases to actually emerge, and they cause chronic diseases to accelerate. On the left-hand side here is an image of an individual just showing you that the relationship of sleep disorders to these other well-known chronic diseases is very high, very much associated with the actual cause of these disorders. Things like AFib, 70% of people with AFib actually have an underlying sleep disorder like sleep apnea that is driving their AFib. And oftentimes when the cardiovascular specialist sees somebody for AFib, they'll send them to get a sleep study right off the bat before they do any further testing, because that's such a significant finding within that population. And once treated, it actually helps to control the AFib. We know the same thing's true for type 2 diabetes. We know the same thing's true for hypertension, one of the most common conditions that people deal with in the United States. What's even more interesting within hypertension is not only does 37% of folks with hypertension have sleep disorders, but we know that around 85% of people with multi-drug dependent hypertension, that's when you have to take 2 or more medications to control your hypertension, 85% of those folks actually have a sleep disorder like sleep apnea or insomnia that are causing their hypertension to be difficult to control. So this is an area that we really need to focus on, because this is an underlying issue that's ultimately very easy to control, that often goes unremarked upon and under appreciated. And in a study from just last year, over on the right-hand side, you'll see that this is an interesting association that was found between the number of comorbid diseases, in other words, the number of these chronic diseases like coronary artery disease and heart failure or stroke, and the total number of hours that people sleep. So sleep duration. So again, sleep duration is the most common factor that we measure out there in research. And what you can see here is that people who sleep in that 6 to 8 to 9 hours, that's actually where you see the lowest number of comorbidities. And then if people sleep less than 6 hours, you see a much higher number of comorbidities. We also see that over 9 hours of sleep, this increases well, or over 8.5 hours, an increase as well. That may be just due to illness itself causing people to spend more time in bed. But this is something we've seen over and over again, this U-shaped curve, that there's a sweet spot for the sleep duration of human beings. And so when we sleep in this sort of 7, 8 to 9 hour period, we tend, as an adult, we see that there's a much lower incidence of chronic disease, of mortality, of a number of different chronic diseases and outcomes. So this is why sleep matters, because actually at the heart of it, it is the major driver of health. It helps you to recover on a daily basis. And when you're not getting enough of it, or it's not adequate enough, then it actually leads to chronic disease. And that's the underlying problem that we're going to talk about today. Okay. Let's talk about some of the chronic diseases themselves in a little bit more specificity with regard to what is it that sleep is doing to these different disorders or causing these disorders. So the first one's type 2 diabetes. And let's talk quickly about type 2 diabetes. What is type 2 diabetes? Well, type 2 diabetes is currently a very, very common condition. It actually affects over 30% of American adults. It looks like it may be headed towards around 50% if you include pre-diabetic, pre-diabetes as a component. About 50% of the United States may be suffering from this over the next 10 years. So it's a very common condition. And it's something that's caused by your excessive eating. Actually, it's presenting too much glucose into your bloodstream, and that glucose causes insulin secretion. And over the course of time, insulin is actually the appropriate response. It helps to put glucose away into cells, so you don't end up with high levels of glucose in your blood, which can damage your blood vessels and your heart. And over the course of time, your insulin receptors stop working because they've seen way too much insulin, because there's been way too much glucose in the body. So eating excessively actually drives type 2 diabetes and pre-diabetes. So we do know there's also there is also a genetic component to type 2 diabetes. There are certain people that are more prone to this, but again, it can be controlled with diet and exercise, and you probably have heard that before. Well, so what happens with sleep itself and causing type 2 diabetes? Well, one line of evidence that we have is that short sleep duration, again, the most commonly studied form of sleep issues, actually may be driving your appetite hormones in the opposite direction. In other words, when you get a little too little sleep, and in this investigation you see in the purple bar those are people getting getting 4 hours of sleep a night in bed, with just 2 days, versus people getting 10 hours of sleep in bed in the green bar. You see a reversal in hormones, the one being leptin, the other being ghrelin. And the ratio of leptin and ghrelin actually is what drives your hunger. So people who are sleep deprived, getting not enough sleep, are driven to eat more. And that hunger actually is what we believe is driving the overeating in type 2 diabetes, or resulting in excessive insulin secretion that leads to the insulin insensitivity that we know is a precursor and causative of type 2 diabetes. What we also know on the slide, or on the image next to the purple and green bars, is that just on a single night of sleep deprivation, if you take somebody and just sleep deprive them just slightly, just give them less than 6 hours of sleep, you find that their insulin sensitivity the next day is reduced by 25%. In other words, you've made them insulin insensitive just on the basis of not giving them enough sleep in a single day. And if you test them using what's called a glucose tolerance test, you show that their glucose tolerance has been decreased as well by 23%. So what we are seeing is that there's a direct relationship with the amount of sleep you get and the ability to manage glucose and insulin that actually can predispose you to type 2 diabetes. So these experiments are very basic and work directly into the physiology. This is data that we've had for a number of years, actually. And so large organizations, organizational bodies that control endocrinologists and then help educate the medical field, one being the International Diabetes Association, they actually came up with this statement in 2008 and published it in their own journal to endocrinologists, saying that sleep disordered breathing itself, or sleep apnea, is just one of the major quality interruptions of sleep, actually is a major cause of type 2 diabetes. And so much so that they made the declaration that every clinician working with type 2 diabetes patients should be screening them for sleep apnea, as well as other sleep conditions that impact sleep quality. And as you see on the right-hand side of this image, sleep apnea doesn't just cause quality issues related to fragmentation of your sleep, which, as your airway closes, apnea is actually a Greek word for no breath. It means that you're sucking your airway closed. You might hear snoring as an associated finding there. But that fragmentation is waking up the brain and waking up the what we call sympathetic nervous system, that leads to increases in things like cortisol or catecholamines, which are like adrenaline, in the middle of the night. It also leads to drops in oxygen. Every time the airway closes, oxygenation is lost, and it activates inflammatory pathways. It also drives those leptin and ghrelin pathways in the wrong direction, so you tend to get hungrier and you gain weight, which makes the sleep apnea worse, as well as makes your insulin resistance worse and causes glucose intolerance and type 2 diabetes. So this pathway is well understood. It's been demonstrated physiologically, and we know that sleep quality and duration, at least, have a major impact in causing type 2 diabetes. So why haven't we been focusing on it? And that's a good question. And that's largely because we don't take sleep as a risk factor that can be easily modified in the general medical practice. So this is why we're talking about it here today. Let's talk about another even more common issue, which is hypertension, high blood pressure. And as many of you know, high blood pressure, it's associated with what is your arterial blood pressure. It is associated with a specific number. In the past, it was always 140 over 90, so 140 being your systolic. Diastolic underneath was the 90 number. Turns out we've lowered those criteria in the last few years down to 135 or 85. So a larger number of people have hypertension, but the idea is that if you have this elevation in your blood pressure, you're at risk for a lot of downstream issues and damage to blood vessels in your heart and your brain, which lead to a number of significant comorbidities like stroke and heart failure and even heart attacks. So getting ahead of hypertension is actually one of the major public health initiatives so that we reduce downstream disease. So let's talk about what may be causing hypertension. And here is a number of interesting findings. The first is that if you just look at people, and this is actually a study that was done in men, I think around the age of 50 and over, they found that when they quantified the amount of deep non-REM sleep, which is a major part of your sleep that actually causes your blood pressure and your blood glucose and a number of things to become normalized, that when you look at that population that's getting the least amount of deep non-REM sleep or deep sleep, there's a much higher increase in the risk of hypertension. So in that population of men getting the least amount of slow wave natural deep sleep, they had a 2-time increase in hypertension compared to all the other groups. What's also interesting is that we know that people who have poor sleep quality due to sleep problems like insomnia, people with that poor sleep quality, so interrupting again that deep sleep, actually increases their risk of hypertension again by about 2 times or 200%. But when you couple that poor sleep quality due to insomnia with a reduction in sleep duration below 6 hours a day, that increases your hypertension risk by 400%. So a 4-fold increase in your risk for hypertension. So we're seeing a direct linear association here with the quality of your sleep, but also the duration of that quality increasing the risk for hypertension. And the last thing I'll leave you with on hypertension is that it's not just the duration and quality associated with the sleep that you have, but it's also looking at some of the sleep disorders and the degree of those sleep disorders that actually lead to a degree of hypertension. So in the graph to the right, you see a log ranking of 4 different groups. And this study showed that over the course of many years, this is 15 years of studying people without obstructive sleep apnea, which was the poor sleep quality issue, people with mild sleep apnea, moderate sleep apnea, or severe sleep apnea, there's a direct correlation between the degree of that poor sleep quality caused by sleep apnea and the degree of hypertension, the amount of hypertension in those populations. So what we know here is that deep sleep is actually the main therapeutic that you get on a nightly basis to reduce your blood pressure and to keep it under control. But when you don't get enough of that deep sleep, it actually leads to hypertension. And if you reduce the quality, the duration of your sleep, it gets even higher. And then if you put on top of that a sleep disorder, and then to some degree a mild, moderate, or severe amount of it, you really do accelerate your possibility of having high blood pressure. So pretty stark evidence that's very direct. Let's talk about cardiovascular disease. Now, definition of cardiovascular disease is pretty broad. This could actually mean something along the lines of heart failure, which is pretty significant and severe. It could also mean that you have an arrhythmia, like AFib, which we talked about earlier. But it could also mean that you have coronary artery disease, which is a disease of the blood vessels of the heart, similar to stroke, where they get congested with atherosclerotic plaques, or they get buildup of damage to the interior of the blood vessel. And that clots off the blood vessel and robs the muscle of the heart from its oxygen, which causes causes the heart muscle to die, which is a heart attack. So cardiovascular disease has many different potential outcomes. But what we do know is that if you reduce sleep duration, again, below 6 hours a day, it increases the overall age of your heart. And this is a statistic, and actually has been developed by the CDC and the Framingham study, which is a very large study, has been done over multiple generations now in New England, looking at the all causes of potential heart disease. And they've come up with this idea that we can actually take a look at your heart based on your risk factors and tell you how much older is your heart than you. So you might be 50 years old, but your heart's actually 60 because of smoking and because of high lipid levels and because of high blood pressure. So if you can control those, you could actually get your age of your heart maybe even younger than your 50-year-old body. But what they found is that if you're sleeping less than 6 hours a day, on average, everybody just sleeping less than 6 hours increases the age of their heart by on average 5 years. So that is a major modifiable risk factor that most people are unaware of. And this is just a research study that just came out last year showing this excess heart age related just to sleep duration. So even if you just sleep a little longer, you can actually reduce the age of your heart. Um, Absolutely well established also are specific sleep quality problems like insomnia and their relationship with cardiovascular disease. And you see on the image there with the blue boxes that insomnia itself leads to atherosclerosis. It leads to insulin resistance and hypertension and serum lipid levels that are elevated. These all increase your risk for cardiovascular disease. And of course, sleep apnea as well. We know there is an increased risk for congestive heart failure, one of the worst outcomes in terms of cardiovascular disease due to sleep apnea. But what we also know is that this happens in all age groups, by the way, but we also know that by treating your congestive heart failure with the therapy for sleep apnea called positive airway pressure, it is actually protective against heart failure. And you see that over in the graph to the right, where the population with sleep apnea that receives CPAP actually has a much lower trajectory in terms of chronic incidence of CHF failure, heart failure, compared to the population that was not treated. So this is something that we know once we can eliminate the quality issue, whether it's insomnia or sleep apnea, we actually are going to be able to reduce the potential outcome of things like heart failure and protect people from these devastating diseases. Okay. One of the other scourges of our population right now is obesity. And I probably don't need to tell most people the bigger story here because they probably see it out in public constantly, but our population is obese. Again, obesity is a criterion that is established by the Centers for Disease Control and Prevention in Atlanta. And what we utilize in medicine is a body mass index, which is your height squared divided by your kilograms of weight. And that is our best thumbnail for establishing obesity. Anybody whose BMI is above 30 is considered in the obese category, and then above 35, it's different categories of obesity. So using that as a standard marker of obesity, since the 1960s, there have been many studies demonstrating or actually measuring sleep duration as well as the obesity rate in the United States. And interesting, when you plot them against each other, and you see this on the left-hand side, sleep hours themselves, which is noted with the diamonds, the black diamonds, actually has been going down since the 1960s, where the average is around 8.5 hours of sleep a night, down to, and I extended the line actually to 2015 in red, all the way down to 6.2 hours. So we have had a decline of over 2 hours in average sleep time in American adults over the last 50 years. And at the same time, we have seen an obesity rate escalate from just over 12% back in the 60s to well over 35% now. And these two graphs intersect very interestingly in the 1980s, which is actually when a lot of sleep duration and 24-hour, 7 days a week activity started to really take hold in this country. In 2013, actually, a number of researchers have been noticing this, actually, this obesity change with sleep time. And there's been a lot of speculation about, well, maybe they're directly related, just as this graph would suggest, but what's the physiology behind it? And so in 2013, there was a very pivotal human study done at the University of Pennsylvania that showed by just reducing sleep duration itself in a population well controlled in a laboratory environment, that sleep duration change, controlling everything else, caused weight gain. And the individuals in the population, as you see in the graph, the dark bar on the right, when they're sleep deprived, increase the amount of food eaten directly proportional to their sleep deprivation. And this was something that was demonstrated time and time again within the study. So it's actually well documented now. This is a major cause of overeating, which is the cause of obesity in this population. Even more interesting is that when you look at not just sleep duration, but sleep quality again, and here we're looking at sleep apnea as a deterrent to sleep quality, it's a major cause of visceral body fat. And in this study here with CT scans, looking into the actual body itself and measuring, quantifying, not just the subcutaneous fat, the fat that's under your skin that you might see, but the more disease-causing or associated with disease associated fat called visceral fat that lives in your body, around your organs, that also lives around your blood vessels. That visceral fat is actually increased in people who have sleep quality issues. What the study also demonstrated that was quite interesting is that when you reverse the sleep apnea, again, using positive airway pressure, everybody doesn't necessarily lose weight. As you can see, somebody here went from 70 to 71 kilograms, actually gained weight. This other person lost 4 kilograms from 80 to 76 on the bottom. So it wasn't the weight change, it was the composition of their body once they were put on positive airway pressure. In all cases, whether they lost or gained weight, they lost visceral body fat. So the composition of their body changed. So the damaging visceral fat actually was reduced. So this is interesting because it's changing your physiology, not just your weight, but the composition of your body. And a number of other studies, which I didn't have time to include here, demonstrate that when you go on a diet, and if you have a sleep quality issue like sleep apnea or insomnia, if you don't treat that sleep quality issue and you go on a diet, even if you lose weight, your body composition doesn't change. So the visceral fat stays. And oftentimes that's why people gain weight again, because their body composition hasn't changed. So this is a very interesting and directly relatable issue to obesity and sleep. Our last chronic condition, and we'll get on to some questions afterwards, that we want to bring up is depression. And this may not seem as easily relatable, but actually it turns out that this is probably the most common condition when we take away our sleep time quality or duration. And this is from a number of really interesting neurophysiologic studies looking at brain imaging that showed that when you have poor sleep quality, and this can be due to any cause, insomnia, sleep apnea, whatever it is, restless leg syndrome, it results in alterations in your actual brain's function. And that functional change here shown with the purple splotches on the different areas of the cortex, here this is a brain dissected out, a human brain, it actually causes depressed mood. So waking up sleep deprived due to a quality issue actually causes depressed mood, directly relatable. We also know that altering your sleep time when you sleep, like when you delay your sleep time, that's also associated with a doubling of the risk of depression and anxiety. And then lastly, the study over on the right-hand side, what we know is if we don't even look at disorders like depression or anxiety, but just your ability to regulate your emotion and your ability to regulate your mood on a day-to-day basis, which we know changes. Well, what's one of the major things that drives your mood? Why did you wake up on the wrong side of the bed? Well, it turns out that we know that those regulatory abilities that are basically a function of your brain, your frontal lobe and parts of the area called the amygdala, they're impaired by any duration, time, or quality issue. And so what happens is your frontal lobes, which actually are circled there in blue, and that you see no activity in, by the way, completely go offline when people are sleep deprived. And what just does go online when people are sleep deprived, which is the brain on the right, is the amygdala overactivates. And when the amygdala overactivates, what we see is impulsive behavior, difficulty with regulating mood, emotional regularity. And that can lead to behavioral and judgment errors and problems with your ability to function in terms of mood and outcomes related to your emotions. So interesting, directly relatable to your sleep time quality and duration. So now how can we improve things? Because this seemed like a pretty dire talk, Doc. Doesn't look like there's a lot of hope here for us, but there is. This is actually, again, one of the most modifiable risk factors for your sleep. So you can improve your sleep and reduce your risk for these chronic diseases really today, tonight when you go to sleep. The main thing to do and to understand is that practicing a routine for the amount of sleep you get, the duration, and the timing of your sleep is a major part of reducing your risks. So if you can focus on obtaining habits, and I'll show you a few in a second, that can encourage physical and mental relaxation at the same time each day, and those are two different things, by the way, physical versus mental relaxation, that's something that can help you to foster a routine that provides you with the amount of sleep and when you sleep, the timing of your sleep on a daily basis, so you can maximize that component and reduce your risks related to duration and timing. Now, once you do that, and I think that is step one, if you still have problems, if you may want to be questioning your quality. So if your timing and duration are good, but you're still not feeling good, it may be that your quality is suffering. And this is the part that's hard to understand because we often don't understand our own quality of sleep. And it turns out that sleep disorders do affect a large population out there, probably 25, 30% of us, and they're silent because we don't know about them. In fact, 80% of people with these issues don't have any idea they're suffering. And it takes them at least a decade to figure it out, and many times they don't. So find help from a professional who can dive into your duration, timing, quality issues. And that's something that we do here at Sleep Charge, and we can definitely talk with you or your company about that and help you find those solutions. So here are the 10 sleep habits that I found that are very effective and that actually are well documented in the literature to really create change. So these are positive daily practices, but you have to have the intention to sleep better. So it's up to you to have the intention to try these. The first one is to make a routine around the transition of the day. And transition of the day means in the morning or at night. So these are what I often talk to my kids about is the edges of the day. So around the edges of the day, you have to make some routines. Getting ready to go into sleep is just as important as getting ready to come out of sleep. And we all get ready for the day. We all have breakfast and we pretty much do it the same way. We brush our teeth the same way. We take showers, we get dressed. All of that sort of happens in a similar manner, and we have alarm clocks to help us maintain that. But oftentimes at the end of the day, the transition into sleep is lost. And so we really do need to create a transitional routine around sleep onset as well as sleep waking up. The second one is to be consistent with your time. And so this is about timing of sleep. If you change your sleep time, the weekdays to the weekend, and many people do, something called social jet lag is pervasive now within our society, especially within our younger group in the millennial population. We see a lot of social jet lag where folks are going to bed 2, 3, 4, 5, 6 hours later on the weekends compared to the weekdays. Well, it turns out that is a major risk factor for chronic disease. So be consistent with your time. Plan the time for your sleep. So number 3 is really about sleep duration. You need to understand your sleep need. If you know you need 7, 8 hours every night, or if you know you're a 9-hour sleeper, and I know my wife is, that's what she needs. If you know that, plan for it. Don't go to bed with 6 hours to spare, because if you only have 6 hours, you're never going to get your 9 hours. Next is number 4. And this is a very well documented effect on sleep quality, and that is exercise. And we could get into arguments about cardiovascular versus CrossFit versus weightlifting versus high intensity interval training, which I think is actually probably most well understood. Those are all different exercises, but what we do know is that compared to people who don't exercise, people who do exercise have much better sleep quality. And this is largely because exercise expends energy, and energy being expended actually is a trigger for deeper sleep and even things like growth hormone production. So definitely try to incorporate some exercise, even if it's just walking or taking the stairs, to improve your sleep quality. The fifth one is a sleep sanctuary. So let's get to the environment of your sleep itself. We often live in urban environments, and those who do actually suffer with excessive light at night and also noise, because you may live near an apartment building or in an apartment building and find that the noise from your neighbors wakes you up at night. So trying to reduce things like light and sound from your sleep environment, and this is particularly important for people that work from home, to have a separate environment where you put your light and your computer and your television and even your telephone at night is very important. And keep that out of your bedroom. Keep your bedroom really for sleep. The sixth one is actually specific, and I want to make this point because light turns out to be the ultimate, it's the ultimate neurochemical activator. And if you get light in your eyes, it's not only activating the areas of your brain for wakefulness, it's also shutting off the areas that cause sleep. So if you put light in your bedroom at night, it's shutting off just through your eyes the areas of your brain that are helping you to get ready for sleep. Number 7 is caffeine-free times 6 and nicotine-free times 3. What I mean by that is that caffeine sits around in your body for around 6 hours. It doesn't leave your brain alone for at least 6 hours. So you definitely don't want to have caffeine within 6 hours of sleep. For some people, it's even longer. It can be 9 hours. So, the 12 o'clock in the afternoon folks that can't have any caffeine after 12 because it'll keep them awake, that's real. That's really associated with its half-life in your blood. The second one is nicotine. Nicotine is a shorter acting stimulant, but it is a very potent stimulant. And it turns out that nicotine, although people do smoke to feel relaxed, it's only because of the withdrawal that you're getting from your nicotine when you haven't had it. It's really important to think about quitting your smoking backwards. And what I mean by that is stop smoking your last cigarette of the day if it's close to bedtime, because that nicotine activity activates what's called acetylcholine in your brain, and that is a major arousal neurochemical that causes wakefulness. So getting rid of nicotine at least 3 hours before bed, but hopefully even further back than that, can be very effective in helping you to sleep more, improve your quality of sleep. Number 8 is minimize food and alcohol at night. It turns out that both food and alcohol are stimulants. Food activates the circadian rhythm through the gut. We talked a lot about the gut biome and the nervous system of the gut. Well, it turns out it's turned on by food and alcohol. The other thing that's important to know about alcohol is that it's also a potent REM sleep inhibitor. So rapid eye movement sleep, which is your dream and neurodevelopment sleep, which kids often need much more than we do as adults, but we do need it too. It's inhibited by alcohol. And if you do that, you change the regular flow of REM and non-REM sleep stages, and that really degrades your sleep quality. Now, the difference between physical and mental wind down is number 9. This is important to note because most people, when they say they're winding down, they're watching television or they're doing something like listening to music, and that's fine. That's called physical relaxation. That is not mental relaxation, it turns out. Mental relaxation is more of an internal activity. It can be like reading. Reading is a very mentally relaxing thing, unless you're reading something that's very salacious, that makes you angry, something political. Please don't do that. But something mental like mindfulness meditation, or having a practice of just allowing your brain to take a time out from the natural environment before sleep so that it can calm down. And that's why mindfulness meditation is so useful for many people, or any kind of meditation where you focus on the breath or you focus on how your body's feeling, and even having some surround sounds that are natural, like wind, water, or waves. Those tend to help calm the mind. So that physical and mental wind down are very important. And then the final one is keep it simple and follow your plan, because all of these ideas are just ideas until you can actually make a plan for yourself and do it in a way that makes it easy to follow. Just like you do in the morning when you get up, you have a routine. In the beginning, you might want to make a checklist about what you need to do at night if you've never had a routine to build it and be successful. So keep it simple, folks, but make sure you do it. Lastly, I just want to cover what we do as a company, what we do, and what our program provides to large populations is everything we've been talking about, which is getting people aware of, first off, what is my risk? What is it that I am doing with my sleep that could be better? And what can I do to reduce my risk for things like chronic disease, as well as just for my own mental health, my own emotional health, and my well-being. So we do that. We work directly within wellness programs that are on site already, or we work directly into clinical programs that are on site through on-site clinical programs. We do a lot of education like this directly within the population. We do it through different kinds of media. And then we get people to do a self-assessment. And that self-assessment is done completely online through our algorithmic clinical validated tools. And they provide you with your sleep charge duration, timing, quality scores. And duration, timing, and quality in this checkup only take about 5 minutes to do, 15 questions. And it provides you with more information about these sort of unknowns about your sleep and give you ways to quantify areas that you can do better for yourself and take some next steps. We provide those next steps with professional guidance. Those pathways to better sleep through your duration, timing, and quality are supported by individuals who are well-versed in helping people find solutions for their sleep, all the way up to sleep physicians that provide clinical diagnoses that will help you find a therapy that will resolve your sleep quality issue, if it's sleep apnea, insomnia, restless leg syndrome, or put you on a better course for sleep timing and use light therapies and a number of other circadian timing modulators that can be very effective if you're working on a shift work. But whatever it is, it's all managed through our continuous support program. So that group that guides you and gets you into care doesn't just leave you to your own devices necessarily. What we also do is provide you a continuous source of support. So we have our care management, our sleep care team, always behind every therapy and behind every program, whether it's a mindfulness meditation program to help you synchronize your mind and body, which we provide, or a sleep apnea program with positive airway pressure devices. All of those therapies are on our platform. They're part of our program, and data flows directly to your care manager so they know how effective that therapy is and what they can do to proactively make it better for you. And you will always have that person by your side every night that you sleep. That is our presentation today, and I thank you all for your questions, and hopefully I have the answers. Megan, back to you.
We do have a few questions that have started to come in, and the first one is, how do you determine the correct sleep timing for you?
Oh, great question. So sleep timing itself is largely genetic. So actually you're born with that bit of either you're a little bit more delayed or a little bit more advanced. Often we call folks who are delayed the night owls, and those who are morning are the early morning larks. So know a little bit about yourself. Think about when you were on vacation last, when you could sleep and wake on your own schedule. I don't mean a family vacation where you were responsible for the kids or the parents, but when you had a chance to really kind of on your own one long weekend or even like a quick vacation for yourself, what was your natural wake time? What time did you go to sleep? That helps you to sort of understand what we call chronotype is. Most of us fall in the middle. So most of us get sleepy around, as adults, the 10 to 11 o'clock, maybe even as early as 9:30 to 11 o'clock period of time. And then our wake times vary anywhere from 6:30 to around 8 o'clock. So if you're later than 8 o'clock in the morning waking up, you might be a little more delayed than most. If you're waking up earlier than 6:30, you might be a little bit more advanced than most. If you find that you're getting sleepy before 9:30, you might be a little advanced. If you find that you don't get sleepy until well after 11:30 or 12, you might be a little bit more delayed. But knowing that about yourself is important because it helps you to plan your sleep according to your natural rhythm. And oftentimes as folks who are delayed, we say, hey, you might want to get a job as a night watchman. But that may not be the best thing. It may be better for you to have some flexibility and have some ways to work from home so that you can work in the evenings when others may not be at work, but you are. So there are a number of strategies to manage that. Plus, there's also therapies like light therapy that can help you to advance or delay your own sleep, your own actual natural rhythm, so it can be more in sync with a rhythm that you'd rather have.
The next question I have is, what is the risk of taking Advil PM over long periods of time?
Advil PM. Okay, so what is Advil PM, first of all, right? Advil PM, like all the PMs that you'll see over the counter, are antihistamines. They are basically Benadryl. So all of the over-the-counter sleep aids are either Benadryl or some form of melatonin, and then some also have what's called GABA in them, which tend to be the more the more sleep activating of the three. It turns out antihistamines don't really work as sleep aids. Antihistamines actually are antihistamine. So histamine in your brain is the chemical that causes wakefulness. And when you take an antihistamine, you knock out wakefulness. So antihistamines really don't help with sleep. They just knock out wakefulness. And for those people who have anxiety or a little bit too much going on in their head, they knock out that wakefulness with an antihistamine. It may be effective one day. The problem with taking it over and over again is that the histamine system is very dynamic. And that means that it reacts to the stimulants or the medications that you take. And so over the course of taking it a couple times, you may notice it's not working as well. And that's because your histamine receptors stop activating. And they don't tend to work in conjunction with the antihistamine as well. So it doesn't have a very good long-term effect. And in some cases, you may even find it's difficult to wake up in the morning with an antihistamine because it's so effectively reduced your ability to be awake.
That's great. Thank you, Dr. Dermer. Well, again, as we approach the top of the hour, on behalf of myself and Dr. Dermer, we thank you so much for taking the time to